So there's a lot of different ways to deliver hormone therapy if we decide that hormone therapy is right for you. There's pills and there's creams and there's patches and there's even injectable pellets. And a lot of people have heard about pellets, and it sounds a little intimidating to people because they are implants that stay in and take about 3 to 5 months to absorb depending on the individuality of the person. But they can be very effective for giving symptom relief over a period of time without much maintenance. They are natural and plant-based. They're well absorbed in the body, and they provide a steady release of hormones over time. So it's one of the things we see with pills and creams is that the hormone levels go up and down, and this causes some instability, and even sometimes some symptoms are relieved and not others, but pellets seem to give a very steady dosage of hormone over an extended period of time, providing longer lasting and effective relief.